Welcome to today's webinar, Leveraging AI to Improve Patient Engagement. This is Ashley Myers, HFMA's Client Services Specialist, and I will be moderating today's session. Now, it is my pleasure to welcome today's speakers. Courtney Daniel is the Vice President of Patient Financial Management at Civista. Courtney brings 17 years of patient interaction management experience in a career that spans the healthcare industry, from revenue cycle management to working directly for insurance payer Blue Cross Blue Shield. In his current role, he leads all patient interaction service teams in delivering highly effective and compliant resolution of accounts identified as patient responsibility. John Hadaway serves as the Senior Director of Continuous Improvement and Automation for Civista, leading process enhancement across service lines with the focus on leveraging automation and new technologies for greater efficiency and effectiveness. John has 17 years experience working with healthcare organizations across the country, helping them to identify the root cause of business issues and develop and implement tailored solutions to drive measurable results. And with that, John, I'll turn this presentation over to you.
Thanks so much. It's great to be with everyone today and appreciate you all taking time and look forward to having a discussion about really a big topic of the day as we look at how AI and then automation, both supported by AI and kind of more basic automations, are really becoming more and more prevalent across healthcare in a lot of use cases. Specifically, we're going to talk a lot about patient engagement and even narrow that focus a bit more. But hopefully the concepts and things we talk through today and some of the challenges we talk about will kind of resonate and have applicability across broader areas within healthcare organizations. So excited to be here and thank you all. Courtney, I'll let you finish the introduction.
I think Ashley did an incredible job with the introduction, so I won't belabor it much more. I will say that in my role as a vendor service provider, all of the post-service patient interaction service lines that we offer report to me. So that would be eligibility enrollment lines of business, our extended business office offering, and our true bad debt services. And so, today I'll be, I think, a part of this panel discussion with John, the proxy for both vendor service providers and providers directly, thinking through the challenges of how we can use the automation and AI tools that are rapidly being deployed and advanced in support of patient engagement in general and patient responsibility in micro. So John, I don't know if you want to give any more of an introduction than Ashley gave.
Yeah, just basically to touch on, prior to the role I'm in now, focused on continuous improvement and automation, I spent the better part of 15 years or so doing technology implementations and process improvement across a number of health systems of varying sizes. And so as we start to think about a lot of these principles as looking at how do you effectively put, AI processes or automation processes in place, it's near and dear to my heart because you'll probably hear me kind of harp on a few times, really the thoughtfulness of integration and design is critical and that it's not just plug and play. We'll get into a lot of that as we move forward, but that's kind of a bias of my background as well. And so goals for this discussion, won't go into too much detail here, but really it's to talk about some of the concepts and considerations and then some tactical approaches you can take as you're looking at, where does it make sense and how does it make sense to leverage the changes and improvements in technology that are coming down the pipe, and how do you manage the fact that things are changing so quickly? Where do you kind of plant your feet and say, we're going to leverage this piece and this piece, knowing that something better and different is probably coming along the way in the next 6 months. And we're definitely in a period of rapid transformation and expansion of technology capabilities, probably more so than I've seen in the last, 10 or 15 years in a lot of ways since the web really started to explode in utilization. So it's an exciting time to be looking for new solutions and to be able to implement new opportunities. So we're going to start with kind of a brief overview and kind of set the kind of framework of what we're talking about when we talk about patient engagement, get to kind of a common place of discussion and some of the challenges there specifically, talk a little bit about the background of AI, but really where we want to spend the bulk of our time, and I think hopefully where there'll be good value here, is how do we tie those things together? What we mean by patient engagement to the opportunities for AI and technology, and where the limitations are there as well, because that's a big part of any discussion around the opportunities, is understanding where are those limitations and where do we need to know that you can't just put everything into an automation bucket and move forward. So to start with, wanted to start with our first poll and just get some ground rules about how does your patient population respond to automation and AI. And I will say, as this has become something more integral to my day-to-day job, it's something that's more front of mind, but I think in my mind, it's a bit of an extension of, I'm used to calling into a lot of the automated systems and getting shepherded through the phone tree, trying to solve my problems. And I think about from like, how do I feel about that? And where's my comfort level versus where are my parents, where's their comfort level? And then I've even started to have a young son. I've started to even think about, what is his comfort level? And is it something we haven't even thought of yet, the way he's going to interact in a lot of ways with this down the road?
Courtney, I'm really interested, John, to see, with our group of attendees, what are they seeing as, we are engaging in trying to bring these technologies. I'm really interested to see how the poll question comes out in terms of where folks are finding that patients are willing to engage. And here we go.
So fairly even split at the high end between people who are willing in targeted situations and not surprisingly not using it in enough places to know yet. I think that's pretty common, both from a user experience side as well as organizations, and trying to find the right places to use it. In some cases, it's, we don't know what adoption is going to look like. And I'll say with some of the initiatives we've undertaken, we've had to do so a little bit on speculation of how will patients adopt it. That's been a bit of an unknown, but I think we're starting to see more and more willingness. All right. So I was going to say, we'll dig into that, but I'll let Courtney start with kind of setting the framework of what we mean by patient engagement.
Yeah, I want to take us a couple of moments, and John said this very clearly. I don't think we need to spend a lot of time in these framework, but I think it's important for us to ground into what do we mean when we say patient engagement, make sure that that aligns with your understanding of patient engagement, and then sort of give a canvas for where we're trying to paint as we start to bring in these other automation, AI, and machine learning technologies to support it. So, first, when we think about the scope of patient engagement, I think it's important to think of this, as a continuum that begins well before patients are scheduled. It's part of the community outreach and branding that you have as a provider or that you're supporting as a vendor service partner. It consists both of all the ways that you're going to reach out to patients, but also a way that you accept and make easy for your patients to communicate back to you, that bilateral communication. Does it feel natural? Does it allow patients to get all the information they need and allow you to react to what your patients are saying in a way that improves their experience? And then, I think it's important, and we certainly spend a lot of our time here, given what we do, to make sure that all of your vendor service partners are aligned with your vision around your engagement strategy, your branding, your idea of the sort of ethos that you want in as a throughput through your patient engagement strategy. And oftentimes there can be multiple vendor service partners that are going to help you from, anywhere from this advertising and marketing through billing and statement and invoice. And so, we are looking for ways to help assist our clients who are healthcare providers think through every way that automation and AI can support the patient engagement continuum. So, as we sort of said in the last slide, the patient engagement is really all encompassing to your patient relationship before and after service, and the value to patient retention is incredibly high for all of providers and vendor service partners that help support providers. And when we are thinking about places that we can improve the experience, not all of them will use automation, but there is a place for automation and AI. We believe, in advertising, scheduling, platforming, registration, access, provision of services, post-service, clinical support, health information sharing, and then even in the way in which you are customizing the message and the tools that may be embedded in your billing statements and invoices. And so, we're going to, in the sort of second half meat of our conversation today, really talk about some of the questions we're asking, and then where are we looking to leverage these technologies to help us solve them. In my day-to-day, John talked about what's near and dear to his heart. What's near and dear to my heart is patient responsibility. We are seeing a influx of the percentage of repayment being shifted more and more to patients, for service providers getting patients to a place where they have real understanding and clarity of their liability, and tools that help improve your outcomes in terms of recoveries is more and more a essential part of keeping health systems solvent. So patient responsibility as a subset of your broader patient engagement strategy still begins prior to service. It means that you are supporting not just repayment from patient, but also the idea of how do I make it easier for you to be aware of and to access third-party benefit sources, whether those are community, government funding like Medicaid, charity, loan programs, and do those things. Are they offered to the patient at the right patient at the right time, in a way that they understand and can access those things? I mentioned before that, criticality of finding all of the ways for patients to have a funding source, because you're seeing a shift from payer to patient in terms of the percentage of the healthcare liability that they are responsible for, and they don't pay at the same rate that payers do, because they don't have the very deep funding pockets that you see. When I was working at Blue Cross Blue Shield, you're getting this from individual people, and so we have been as part of an ongoing strategic planning strategy, thinking about how our messaging and general approach to repayment can be better, can be cleaner, can create greater clarity for patient. And that is both something we think you can do in support of your bottom line performance, but also to edify your patient satisfaction scores and patient retention goals.
So as we start to move into what some of the challenges are as a part of patient engagement, wanted to put another poll to everybody to kind of see what you're seeing as the biggest challenges in your organization, whether that's related to creating those patient level target strategies, obviously the balancing of information availability and capability of systems with security and privacy is critical within healthcare. Looking at the patient experience across service levels and service types, different types of patients in different scenarios are going to have different preferences. The ever-present regulatory landscape that's out there, both at the state and federal level. And then I think fundamentally the cost of finding the right people to serve in these roles, because how you engage with your patients is certainly critical to how the community perceives you as a whole and at the individual level. And so finding the right people is absolutely critical. All right. So a good mix of answers, tailoring the patient experience kind of by service, balancing information. I like that regulatory is the least concerning one. I don't know if that's just because of the criticality of the others, or if everyone else has just had good fortune with managing those regulations. So, but we're going to talk about each of these kind of as we move into the next couple slides.
As we sort of bring our patient engagement kind of overview and grounding session to a close and start to talk about sort of the history of the AI and automation tools, we thought it was important to sort of talk through the challenges that hopefully, align with some of the things that you guys are seeing, that we are trying to solve. And that's really connecting to patients in the right method. We say connecting to patients where they are. It means, I think, not only the message type, whether phone, email, text, chatbot, an omni-channel strategy, but also can we get even variable in the messaging and the tools that are available in the right message at the right time? And so that challenge we're looking to solve. Our second challenge is managing the increasing flow of questions. The complexity of healthcare is not something I need to explain to this group. And patients are finding more and more that they really do not understand. And how do we introduce, real education and clarity when you get patients to a place where they understand that they have been billed correctly? It leads you to fertile ground for them to feel comfortable paying their liability. And as we work on behalf or with providers, we want to understand that every account, in your active AR is not valued the same, especially when you talk about as it moves into patient responsibility. And so how do we identify both the floor, the minimum amount of contact that is required through regulation or through a consistency with our patient experience considerations, but also where can we apply better diligence, better intelligence to say that the most valuable accounts need to be touched in either different ways or by different resources. And that leads us to creating a customized patient experience at scale. And that's, the real challenge. I think this was our number one in terms of the challenges that the audience found. This idea of tailoring to my individual audience is very attractive, but we can't make this a completely tailored, at least not yet, experience. And so you have to find ways to find what are the salient likenesses in patient populations, and then how do I find the right way to either connect, the right time to connect, or the right method to connect. And lastly, I think this one was also very high, and this is near and dear to my heart specifically. There are, post-COVID, post a, real increase in line level wages, keeping highly qualified problem-solving staff with great interpersonal skills that allow them to be rock stars in your patient interaction space is becoming more and more of a challenge. And, what we're looking to see is, can we inject other technologies, including our foray into even an automated agent that can do some of this with the level of consistency and quality that we expect of high level performing problem solving staff. So those are the challenges that I think we're going to double click in, after we sort of go through a history. John will walk us through of like how the technology has gotten us to where we are now.
Yeah, definitely. And on that last point, just so I don't, neglect to kind of touch on it later, though I'll probably end up repeating it. When it talks about people, I know kind of one of the first thing that comes to mind is you create automations and use AI and other technologies as a way to reduce your people cost. And certainly that's one thing that it can be used for. But the other thing, and I think this is, certainly something we try to do, is it's also a means by which you can scale up the impact of your best performers, that you can leverage them in a way that gives a greater impact. So in a lot of ways, and we'll talk about this, these opportunities increase the value of the people who are doing the work, not just a kind of rote replacement. But as Courtney mentioned, I want to spend just another minute or two kind of going through background of AI, kind of grounding on what we mean when we talk about AI, and kind of the spoiler alert there is everybody thinks everything is AI if it has something to do with automation, especially if they are a startup company trying to get seeded for multiple billions of dollars in an acquisition. They put AI in their name. And in truth, it's a little bit of a gray line, but we'll talk a little bit about the background of it. But before we do that, another poll to kind of precede. What is the first thing you think of when you hear AI? Is it ChatGPT, Copilot, Terminator, or maybe The Matrix or something along some other Hollywood indication of computers taking over the world, or just something else altogether? And I think of late, ChatGPT's gotten a lot of play. Microsoft certainly has kind of the pre-existing name branding. But as we'll talk about, I think ChatGPT has really kind of broadened the horizon as to what AI is and potentially can be in the near term. Yep, and ChatGPT takes it with 70%. I do appreciate the three of you who selected Terminator. I'm with you on that. So it is interesting how much of a paradigm shift there's been in the last year and a half as ChatGPT has become ubiquitous, and then a lot of tools that essentially function in the same way to make chatbots. So we'll talk about kind of the background of that now. Wanting to go kind of way back though, and talk about AI very briefly, I promise, from kind of a philosophy perspective. On the left there, you'll see the Antikythera mechanism. Hopefully I pronounced that right. I get it wrong about half the time or 3/4 of the time. But essentially, a little over 100 years ago, this was found underwater near Greece, and looked like a slightly complicated machine relative to where it was found. And then once they aged it and understood that this thing went back to the BC range of time, really became more impressive. And over time, as they've been able to look into it and do some disassembly of it into smaller parts, they've kind of started to understand that it acted in a lot of ways to predict the movement of planets and stars and things across the heavens, even predicting eclipses and things like that. And why that to me is kind of important when you think about AI is it has nothing to do with computers in the kind of digital sense that we're used to, but it is a very early example of an attempt to take human intelligence and program it into a machine. In this case, a mechanical machine, not a digital one with transistors, but still the idea of taking intelligence and the ability to extrapolate. Even though it was based on mechanical principles, it's still, at least a cousin to the idea of what AI is. And so really kind of the point there is, to me, the idea of AI goes back as far as the idea of kind of critical thinking and thinking about thinking itself, and how to take human ingenuity and put it into non-human objects. And over time, we've moved from simple machines or complex machines into the digital age with computers, which has enabled a huge upswing in capabilities. In the mid-1950s, kind of some of the theories that really underpin what we see as AI today really came through. And then in the 80s and 90s, really there was some slowing in the development because the digital technology really couldn't keep up with the ideas. But then as we moved into the latter part of the 90s, machine learning as a discipline started to become more and more prevalent as machines became capable of processing more and more data. And then, in the last 10 years or so, generative AI has become kind of the new big thing, as ChatGPT and the others like it have really kind of taken the world by storm. So AI today, we think about ChatGPT, and it's kind of came forward with a like an instant messenger chatbot type interface, and that's still a fairly common mechanism. But I think we'll see over the next several years the same kind of underlying capabilities packaged in different ways, different modalities, to reach different people. And some of that's what we're going to talk about here as we talk about how do you meet people where they are and use these technologies in seemingly highly specific yet still manageable and consistent ways. So a couple of bookend quotes about kind of AI and its development and how it relates to other technologies. I think the first quote's pretty commonly quoted: any sufficiently advanced technology is indistinguishable from magic. And it's that idea of when a new technology comes out, there's this idea of wonder, of, wow, how can this possibly do this? It seems like magic. And I will say, even as involved in tech as I am, the first time or two I had interactions with the earlier versions of ChatGPT, it felt like magic. But then the next quote really speaks to where we go. The most profound technologies are those that disappear. They weave themselves into the fabric of everyday life until they are indistinguishable from it. And I think about things like the web. I think about something like an iPhone, or the analogs that other companies make, that when that first came out, it had that magic moment of, wow, how can I get a message or a phone call from a person on the other side of the world, talk to them real time, eventually see pictures of them, eventually watch a live news event or sporting event through invisible waves that go over the air, and just that idea of wonder. But as we've moved forward and have gotten to a situation where we're very used to that, it's still wonderful. It's still kind of amazing when you step back and think about it, but we don't think about it that way anymore. And it's hard to imagine life existing outside of it or without it. And so that's really kind of the path that we think about, as we think about how do we use AI technologies to support, the patient experience and patient engagement, is moving from that idea of this is new and novel and different to, well, this just seems like the natural way of doing things. But a couple of kind of key points. One, it's not easy. I will say a lot of the advances in AI and some of the underpinnings of it have started to make it easier to put these things together and to build systems and integrate systems, but it's still a lot of work. It still requires a lot of thoughtful design to do anything kind of materially beneficial. That curve is starting to shift, but it still exists, and it's important to consider as you're thinking about where you invest your time and resources. Key capability, though, of AI is the ability to synthesize large and complex data sets, which goes back to the idea of machine learning. It's really brute force pattern recognition at a scale that we can't really imagine, which gives it the opportunity to draw correlations that maybe people wouldn't have gotten to for a much longer period of time, and do so in a much quicker way. And so that really is kind of the engine that drives it. But then, to me, maybe the most important thing that's developed over the last few years especially is the natural language processing aspect of it, which has changed AI and machine learning and those things from something that you need to be very strong from a data perspective to even interact with, to something that with some right integrations, it's much easier to interact with. You don't have to know exactly how to say something. Data doesn't have to be structured quite as much. And I think about it from a healthcare perspective of moving from the idea that, we went from paperwork where claims went out on paper, everything was written down, to defining code sets to define what procedures were performed, what diagnoses were given, to doing that electronically through standard file formats, to now this really affords, almost going back to the beginning of saying, you can just have unstructured doctor's notes that could be used to generate a claim in a very specific way. It kind of circles us back to that ability to not have to change the way we do things to support the efficient process. The efficient process meets us where we are. And that's an analog for what you want to do as you're looking at patient engagement with automation. And regardless of anything else, it's still an enhancement to human abilities. Everything that AI can do is based on what humans have taught it to do, what humans have trained it to do. And while it's kind of got a self-training flywheel going on, the underlying principles still remain with, where did it start? And that's from building out from human experience and capabilities. And as we talk about process design, keeping that in mind, knowing that there are places where AI isn't the full or correct answer, and there's still a major role for people to be involved. And as I kind of alluded to, within healthcare and revenue cycle management, as the technology has improved, we've kind of gone along that same path in healthcare. I would say in some ways, healthcare can be a leader in this area just because of the scale of data and information we have. But in other cases, we tend to be a little bit slower when you balance in the idea of privacy and security. And so we've kind of followed that same pattern, but just at different pacings as it relates to kind of early machine learning, document automation, moving into analytics and higher scale machine learning, some basic decision logic. And now as generative AI is becoming more useful, more complex analysis, less structured data, more complex decision making, all those pieces. And then there'll be next steps as the technology continues to increase and improve. So now that we've kind of coupled what those challenges are within patient engagement, or some of the key challenges in patient engagement, and a little bit about kind of the background of AI, we really want to dig into how do we take these two things and fold them together, really kind of the meat of what we wanted to talk about today. And, you know, we've got Courtney here who has a lot of experience and very focused on some of the kind of patient responsibility side of patient experience and engagement. But really these things, these principles, I think we're going to talk about apply across the board. Right. So poll number 3 gets into discussing, you know, what type of communications really resonate with you, whether it's physical, just getting something in the mail, email, web portal, people calling you, or just knowing you've got the ability to call back to someone and kind of navigate and get things answered the way you want to. I'll say for me personally, I'm terrible with mailed, physically mailed things. And it's starting to probably creep into my email liking as well. I'm much more of a web portal self-serve kind of person, but there's a lot of different perspectives out there. Courtney, you and I.
Yeah, no, you and I had this conversation, and it's true. I mean, I am like awful with mail, and I send mailings to copious numbers of people every day, hoping they're going to respond. I don't respond to my own, and you know, email has now morphed, even for me, into a place where I really want it to be some sort of URL based web portal and or app. And you know, we talk about that integration of technology becoming like, you know, ubiquitous in our life. I think about the fact that like now I almost think that I'm supposed to have an app for everything, you know, and it's funny. I think the audience agrees that we are moving to a place where patients want that electronic. Yvonne said she hates talking to a computer. That we want that electronic web portal. I think that's what we're seeing play out. I think some of that is, you know, the changing of demographics, but I think it's also because this technology has become a part of our life. We think that you should be giving me the advantages that the phone that can do all of these things that's in my pocket, I should be able to engage with you using it.
Yep.
So when we think about patient engagement areas of opportunity, you know, I think John and I thought that we really, in our current exploration of AI and machine learning tools, really are focusing two sort of different paths. One, you know, how do we insert patient intelligence into our diligence and communication? And then if we think about patient interaction about as a challenge of what's the right message in the right way, then patient interaction is really the other place where AI and automation we're trying to bring solutions to. So when we think about patient intelligence, what's the most impactful payment driving outreach strategies? Can we figure out what's the right time to send those outreaches? And can we be specific in the strategy about what we send, how we send, and when we send? So both understanding the right ones, but then understanding the pattern of the diligence cycle. And we'll go through some of that in some upcoming slides. And then, you know, can we drive the prioritization for, you know, what is the right activity for automated solutions and tools to engage and support a patient, and where, and I think John said this really well, where can we increase the value of our really high performing human capital by always trying to align them with the right interaction, and to know that before you have to go engage every patient with human beings and then route them? Can we use intelligence beforehand and make some bets about what's the right activity for the right kind of resource? And then on the other side, the communication methods, can we integrate preference in a way that feels like we're tailoring a diligence path, whether that's each time that we communicate to patient, if that's a variation of multiple engagements. I support your letter with an email, with a text, with a link to a pay portal or to a website. How do I help you feel like you want to use self-service where possible? And can that self-service truly be valuable to you because the information you want to get, you have access to without having to engage someone else? And, we want to make sure that that information sharing interface, both in and out, import and export, is continuous, precise, and secure. And so those are the places that we have started to really look at how AI and machine learning can assist.
Yeah. And I think it goes without saying, and we'll talk about this and you'll see kind of the overlapping themes kind of underneath the hood here. But even though there's kind of two separate breakouts here and two separate perspectives on this, there's certainly interaction and it kind of folds together.
Yeah, and so look at this slide like a proxy for a non-intelligent, maybe traditional patient outreach. This really does sort of double click into patient responsibility, thinking about, the first billing cycle experience through the first 120 days. That is, traditional for most healthcare providers where they're carrying a patient balance on their active AR. So this is post insurance adjudication or true self-pay pathways before you're making a decision to write this off to often a bad debt vendor. But you're going to place a file with either a statement vendor or with a vendor service partner who's going to engage a letter vendor to bill your patient. You're going to have that statement sent. You're going to either accept calls from patients who inbound off of that letter if they engage in the letter. You may also, you or your vendor service partner, be making proactive calls in between the statement. Then there's generally, we call it statement is your first billing statement, letter one, but you can think of these as letter one, letter two, but a letter that reminds you that you still have an outstanding balance, supported by calls, whether inbound, outbound, a final statement, often one that is 501R compliant, telling you that this is your last opportunity before you or have the potential to be written off to a bad debt vendor. It calls trying to support before we hit the 120 days. And then finally, account, in our case, return to the client to make the decision to write off the AR and place with the bad debt vendor. And so we think of this as not without the intelligence that we've talked about, a proxy for a traditional patient responsibility early out path. You may be sending 4 letters, one every 30 days as opposed to 3, but I think for hopefully the audience, you get the idea of what this looks like before we ask the questions about how patient intelligence and improvements in our patient communication can be supported by AI and machine learning. And so we asked questions, and really what we wanted to show you here is sort of me and John's experience. John in his role, I come with the, hey, I'd like to accomplish something, and I'll hopefully be a proxy for all of you in the question that I ask. And then John will talk through how we are using and exploring iterative technologies to answer that question. So the first one was, how do we identify and prioritize the most valuable patient accounts to outreach? I said in my patient engagement overview that not every account in your patient portfolio of self-pay is as valuable as any other, whether that's balance size, whether that's the ability for the patient to repay. And, there are ways for us to understand and make bets about who will be able and most willing to pay, but also then, how do you partner that with the value that individual account represents, and where do we want to make those prioritizations available to, again, make the decision about who's the right resource to go assist this patient.
Yeah, and these are places where I think a lot of you will know there's been a lot of work in the areas of propensity to pay, both at the highly complex and robust, as well as a little more straightforward, just depending on your circumstance. But really looking at going beyond just sort by balance and start calling downhill. How do you understand where should the priorities be? And kind of with the understated, there's standard diligence that you're going to do for all of your populations, but this is how do you take any additional effort you're going to apply and make sure you're applying it in the right way and using the right method. And so scoring accounts, but going beyond just the idea of let me look at what my account balance is, even going beyond just what are patient and demographic type things that might sometimes be used, geographic location, to help understand the right mechanism for outreach and timing. But defining value by, how likely is it I'm going to get reimbursed if I take the right approach to getting that reimbursement? And you have to build that into your understanding. It's not just from this point, what's my highest valuation? It's also what if I do something about how I address these accounts? What becomes my most valuable account? And folding that feedback loop in, looking at what meets your expectations and what doesn't meet your expectations as you move forward, and making sure that you sometimes try things that you don't think are going to work and you go counter to what your analysis tells you to make sure your analysis isn't misleading you and you're not leaving things on the table. And all that then gets baked into a feedback loop that feeds data back into the system that says what worked, what didn't, and making sure that you never get to a point where you say, well, we have finished the model, we know exactly what to do, because everything is always changing, sometimes very quickly and sometimes slowly, but it's important to have that feedback mechanism in place.
Yeah, and so then also, how do we determine the method of communication to drive the greatest patient engagement?
Yeah, and that builds on it. That's a part of, that value proposition gets into how do you unlock that value? What method do you use? And some of the principles there are the same as well, where you want to use information you've got, whether it's indications of, well, this person usually responds to text messages, or this person always pays through the portal, and so they like web-based communications. And sometimes it's things that aren't even directly related to what you would expect when you think about something like a portal. If you have some physician groups who are in service areas who are very diligent about using their patient portals to contact their patients, that might end up being your best mechanism for contacting that group of patients, just because of something that's outside of standard how do you want to get your mail type questions. And so there's a lot of opportunity to fold a lot of different data and context into how you take your next steps and decide what method are you going to use. But the key is, as you try, to continue to fold what you find back into it.
Yep. And then I think one of the things, and John talked about this, that takes the next step for patient intelligence is not just the how, but the when. So how do we determine when to reach out to have the greatest chance to be impactful? And, how do we use the tools to help guide a timing consideration to our outreach?
Yeah. And the worst time, and I think this is a carryover, see the same thing when you're dealing with AR with payers, the worst time to reach out to try to get someone to make a payment or provide information is, 5 minutes before they were going to do it themselves. So it's looking for how do you become predictive in when the people who are going to respond on their own will do so, and understand when that's a good enough outcome. You don't necessarily always need to improve the response time frame by an hour and a half or even a day if you can direct that effort somewhere else. And so again, it folds back into the principles of looking at the information you have, but also folding in the findings you have, so that as patient preferences change, both at the population level and individually, as context changes, and so responsiveness may change, and response timelines may change.
And lastly, can AI and machine learning help us determine the variable patient messaging that leads to better outcomes? Can we literally make changes in what we present to a patient in the message that we send? And do we know that it is the right message for the right patient?
Yep. And it absolutely can. And I think here, the bigger considerations on top of the ones we've talked about before of like understanding what works and what doesn't from feedback is defining the scope of how variable that messaging can be. You want to maintain consistency with your overall approach to communication. Also, certainly just with language and tone, you want to make sure you're very careful around that, following regulatory guardrails as well. So making intentional decisions about how variable you want to be and determining what types of platforms you want to use to support that. I would say in most cases in healthcare, we don't want to just give someone open-ended access to a chat bot that has access to the medical record. Concerns about hallucinations and lack of precision and worse, kind of false information being given by a system that doesn't understand the implications of that, whether it's a bad pharmaceutical name or diagnosis information or something like that. So it's understanding and making sure you have both ideal conceptual guardrails in place so that you know what you want to design, but then technical guardrails in place to actually enforce what those ideological guardrails are going to be.
So when we look here, this is a proxy for us to say that, introducing that lower light blue, enhancements, and again, take this as a proxy, this is where your diligence cycle to patients can start to take additional information that we are gleaning from the tools, whether it's true just propensity to pay, but also an idea of the kind of variability that now adds omni-channel diligence at the right timing. Is that a delay based on patients who may self-serve? Are there tools in the messaging that incentivize and make very easy self-serve so that the diligence cycle gets shorter, which is always what we're looking to do? We want patients to get the information they need as quickly as possible and then react, in this case, to repay the outstanding liability as soon as possible. The speed to return cash has value, as well as the fact that when patients feel like that they get their questions answered, they understand the clarity of their billing faster, they are much more satisfied with the patient engagement that is the most difficult, the one where you're asking them to make payment, right? And so this is us sort of showing a proxy for, as we are applying the tools that John has talked about, the transformation that can have in your outreach to patients, in your patient responsibility diligence model. And so the questions we asked around patient interaction, how do we balance patient preference with consistency and accuracy across the interaction platforms?
Yeah, and a big part of this, and it kind of ties into that variable messaging idea from the patient intelligence piece, is first of all, kind of defining what your approach is, what your, as a organization, what your language, your tone, kind of the presence you want to bring to your patients. And I would say it even expresses itself in how you design physical spaces as well, even though that goes a little bit outside of the scope of AI for the most part. But then also it's making sure that from a data and information perspective, that there's continuity across different mechanisms, regardless of what your patient's preference ends up being. And if it changes midstream, especially, that they're getting the same picture, the same perspective, and the same information, regardless of how they communicate with you. And making sure that there are technological guardrails in place, whether that's limiting what types of data are available to automated systems, or what level of data is available, making sure those systems are designed in a way that gives that consistency, but also gives the right level of precision and continuity.
Yeah, and then how do we empower patients to self-serve in a way that doesn't feel like all we've done is out, hey, when you have a self-serve at the grocery store, if there are still cashiers that are available to take you the traditional way, then this feels like an enhancement. If it becomes your Walmart store where they've not had any cashiers and they only have the self-serve, then you may feel like all they've done is shifted the burden to you. We want the technology to feel like an enhancement, especially as we think about edifying the patient engagement experience and not feel like just a shift of responsibility to the patient.
Yeah, absolutely. And I think within that grocery store idea, I'm just waiting on the store where I have to go in and cultivate some ground, plant some vegetables in one section, do some watering and some fertilizing and some weeding in another section, then finally actually get to pick a vegetable at the other end of the store. I kind of have to do all those parts of work along the way. But it is important that, as patients, especially within a healthcare setting, they don't feel like, well, you're just making me do the work for you. And a big part of that is understanding what the outcome of that is supposed to look like. What is the outcome of the process I'm designing? And how do I make sure that it's successful at the end? Because that's going to drive a lot of your satisfaction is, did I get done what I was trying to get done? Or did I spend a lot of time spinning my wheels, doing something I didn't think I needed to do, and I didn't get the outcome I was looking for? Whether that's getting an updated piece of balance information, making a payment, getting other information. And then a big part of it conceptually is also understanding what are the limits of technology, either true limits where the technology is just not there yet, or where the cost to implement and integrate that technology, even if it is there, isn't balanced out by the value to the organization or to your patient population, and designing processes with those limits in mind, and seeing those as a part of your process design.
Yeah. So then how do we design a structure that connects the automation tools that we want and those capabilities to identify they're the right tool, or a human resource is the right engagement platform, like using our problem solving, highly intelligent human labor for this activity? And can the AI tool help us make the decision so that we're routing people as quickly as possible to the right way to be helped?
Yeah. And I think a big part of that is when you designing a process that ends up, involving a human is not a failure of the technology or a failure of the process design. It's still an opportunity to leverage expertise that you have within your organization. And so looking at it that way and designing with intent to say, this is where we can leverage our people to do something that the computers can't, or they're just not good enough to do is the way we want it to be done, which is also empowering for your colleagues as well, because they're seeing, this is a place where I still am adding value, and still have a place to do something that that we can't do, without. So I think looking at it as that as intentional and not necessarily a negative thing, certainly keeping in mind where can you continue to expand usage over time, but looking at that as an opportunity for intentional design.
Yeah, and Laz, how do we ensure compliance? We talked about this. It wasn't a huge concern for this group that we're there, but I think you guys are all seeing that the regulatory landscape is ever changing. It is often layered, so that you may have municipalities, state governments, and federal governments making change. Can we make sure that whatever the AI is doing is aware of those changes? It can help us monitor those changes, and can it make sure that whatever outreach we are doing is compliant?
Yep. I think you covered that one pretty well. Don't have a lot to add there. So what this really gives us in the end is kind of a multi-tiered way of connecting with our patients and engaging them. It's different modalities of how to connect with a consistent framework of what you find when you connect, even though the way you get in may be different and the way you interact and interface may be a little bit different. What you find when you get there has consistency, which is critical to kind of drive comfort, especially as people are looking to get more comfortable with sharing with automated systems. But then also always having that layer where you're going to need it of human capability to support and engage your patients, so that level of security is always there as well. And so I know we're running a little tight on time, so there were a couple other things we wanted to try to
I
touch
think
on.
we
try
can
to
put
get
all
them
three
quicker.
questions out, John, and
Yep.
these are really the oversight questions. I think we've been interweaving this into our conversation, but we want to also make sure that we best manage the quality for both our automated systems and human-driven activities. Are we applying the same level expectation of our automated systems to edify the patient experience? And then, how do we define success and how do we prepare for what comes next? And then, John, I don't know if you want to just sort of give an overview of those oversight conversations and continuous goals that we have to make sure that we are managing the integration of these automations appropriately.
Yeah, the big kind of key things are, as you're doing quality, you're evaluating the quality of the process. So even technology-based processes, AI or kind of standard automation, you want to evaluate based on outcome and give equal kind of outcome expectations to, regardless of how the process is happening, to make sure it's happening effectively. The efficiency is a second piece of it, but as far as quality, there's should be consistency there, and success should be based on those quality metrics, both from the organization's view as well as the patient's view and what they're expecting in that interaction. And then from a what comes next perspective, it's a lot of it circles back to the idea of feedback, but also feedback, vertically within your organization. It's keeping an eye on what new technologies are coming out and what capabilities is that going to drive, but also what are the people who are doing the work day to day telling you are the places where it's not working as well as it could, and there are additional opportunities. So
yeah, I think this slide just is a tying together of all of things. I think John said this really well. We think of our deep dive today in the sort of patient responsibility outreach model, but these ideas about integrating automation, AI, and machine learning tools, I think, can be applied across the rev cycle space in all of the places where patient engagement happens. And so, this is sort of a place to sort of think about the holistic use of these tools in supporting your patient engagement endeavors.
All right, I'll just kind of touch on these. We've talked about most of these pretty quickly, but the key point here is there's a lot of process definitions of success, both what you need, tactically, but make sure you're considering those also along with financial outcomes. But the bottom line should be the bottom line. But if you don't succeed at the top, then that should be something that you keep an eye on from a success perspective. I'll kind of pass through this because I can touch on it here, but just from a key takeaways perspective, this is critical as efficiency becomes more needed and technology continues to improve. But you have to balance your design and your implementations with what the patient's going to experience, and always making sure kind of that bottom line, the human touch, is even more important as you can leverage your strongest capabilities even more.
Awesome. Thank you so much, Courtney and John, for this engaging presentation. And with that, we've reached the conclusion of today's webinar. I would like to thank our speakers for presenting and Savista for sponsoring. We hope you found the presentation informative. Thank you for your participation. Have a great day.